Hello, everybody. My name is Scott Kopenbarger, and thank you for joining us today on OU Medicine Chat. We are talking about the cancer that you never have to get, and we're talking about the vaccine which will prevent that cancer. And joining me today is Dr. Joan Walker. She is a gynecologic oncologist at the Stephenson Cancer Center, and we have got some new things that have happened last year that has really proven effective in preventing cervical cancer. And by the way, it is Cervical Cancer Awareness Month throughout the world. Dr. Walker, thank you for joining us today. We appreciate it.
Well, thank you. It's my pleasure.
We are talking really about one of the main causes, which is HPV. Tell us what HPV is.
Okay. HPV is a virus. It causes warts in general. There's 100 different types of HPV. And so people have warts on their hands or warts on their feet. That's traditionally what we know about HPV. It happens in all the animal kingdoms, so rabbits and horses and all kinds of different animals. So I've been studying HPV my entire career.
It's a sexually transmitted virus.
Well,
right?
the one we're talking about today is, but not 100 of them. The 100 of them are different. So there's, hand and feet, and there's skin-to-skin contact.
Okay.
So it's a skin virus. So it's any kind of skin-to-skin virus, and each of these 100 types likes a particular part of the body. Okay. And so the HPV we're talking about today is called a genital HPV. So yes, men and women are both affected. There's at least 3 million doctor visits per year for an HPV-related abnormality. There's 20,000 women who die every year, and there's 12,000 men who die every year from an HPV-related cancer. And so we now have a vaccine that has been FDA approved since 2006 to prevent these cancer-related deaths. And it is not being prescribed or given often enough.
Okay, before we talk about the vaccine, let's get a little bit more into HPV.
Okay.
What are the symptoms of it?
There aren't any.
Really?
That's the problem. Everybody has it and nobody knows it. So if you're 22, 25 years old, you probably are already infected, okay? And so typically a kid who's prior to menarche and prior to adolescence is not infected. And so the goal is to get them protected before they enter a sexually active period when they would become infected. And so the vaccine's approved for 9-year-olds, and that's the goal, is to try to get boys and girls vaccinated at 9 years old so they never know they never get the disease.
Is one sex more likely to get it than another, or is it pretty much 50-50?
They're not more likely to get it, but they are more likely not to know it if they're male. So girls get Pap testing. I mean, women get Pap testing.
Right.
Okay, so cervical cancer screening makes women more aware of HPV. So HPV is detected on a cervical cancer screening test. So the cervical cancer screening tests are FDA approved now from age 25 on up for both HPV testing with a DNA test and cervical cytology with a microscopic examination of the cells of the cervix.
Okay, and how often should a woman get it?
Every 3 years.
Okay.
And if they're negative. So that's called a double negative, I like to call it. It's HPV negative, Pap negative, then they come back in 3 years. So women know about HPV because they talk to each other, and they have to go in for evaluation if they have an abnormal Pap. And as I said, there's millions of women every year having an abnormal Pap smear. Unfortunately, however, 11% of the U.S. women who should be having Paps have not had one in 5 years, and Oklahoma is one of the worst states. And so one of the reasons that I'm here advocating with you is that 11% of women in the United States have not had a Pap in the last 5 years, and 25% of those without insurance have not had a Pap in the last 5 years. And Oklahoma has the highest uninsured female population almost in the country. And so we are particularly at risk of having people die of cervix cancer in our state, which makes vaccination all the much more critical.
Is there any one type of lifestyle behavior that makes you more prone for
Everybody has HPV. There should be no stigma. It's basically, if you want to have a child, if you want your child if you want to be a grandparent, your child should be vaccinated. You can't have a baby without having sex. And if you have sex, you have HPV. So it's just universal, ubiquitous, 100% of anybody who's ever had a sexual encounter has HPV.
I've got a first question here from Madeline, who asks, why do we still have cervical cancer?
We shouldn't. It's inexcusable. And there is a very rare person who has been vaccinated, who has been screened, and who develops cervical cancer. That is a very rare individual. Most women who have cervical cancer and who die of cervical cancer have not had a PAP in the last 5 years.
So that is why it is the cancer you should never get.
Right.
Okay.
There are two reasons, the vaccination and the screening, yes.
All right. And Stephanie asks, why would someone not want to be vaccinated?
Well, I completely can't understand it. I have communicated with people who've told me their reasons, but they don't make sense to me. You know, people say that I don't want to be vaccinated because I want to tell my husband that I trust him, or I want to tell my future spouse that I trust him, that everybody should never have had sex with anybody else, and so therefore it's impossible for me to have gotten HPV. Well, that's rare. I mean, you get divorced, people die, you get a new partner. Things happen in life.
Right.
So you should do what you can to protect yourself, just like you shouldn't have a car accident, but you still put your seatbelt on.
Sure.
I mean, so to me, there's really no excuse for not being vaccinated. Look at the measles outbreak we have right now. We shouldn't have a measles outbreak in the United States. Don't we all wish we had an Ebola vaccine? We would be lining up for an Ebola vaccine if it was available. So why are we not taking a vaccine which should prevent 11,000 cervix cancers, 20,000 women from dying of some kind of HPV-related cancer, and 12,000 men from dying of an HPV-related cancer. In the world, 500,000 people get an HPV-related cancer, and other people in other countries would be so jealous if they had access to this vaccine.
It's probably one of those things that, oh, that would happen to that person and not me. You'd think. I guess is the rationale.
Well, I think of myself as average and ordinary, and so I want to do what protects me from average and ordinary things. So hopefully people will get that message.
Let's talk a little bit more about the vaccine now. How does it work? There's a couple types of drugs I know, but how does the vaccine?
The new one is awesome. Okay, so the old one was 70% effective, and that was because it only had 4 HPV types in it. The new one has 9 HPV types in it, and so the new one is 90% effective at preventing all these illnesses. It is an antibody against the protein that coats the virus. So there's no DNA in the vaccine. You don't have to be afraid of it. It is just an antibody. It's just the protein. You inject the protein that is on the surface. It develops antibodies against the virus, so that if your body comes in contact with the virus, your body attacks it right from the beginning and never allows it to invade your body. And so it protects, as I said, against 9, so you won't get warts, you won't get cancer. I mean, it's completely awesome, but it has to be given before age 16. And so 9-year-olds, 11-year-olds, 12-year-olds are the ones we are trying to encourage to be vaccinated. It doesn't work if you're already infected. It doesn't treat a problem. It only prevents the infection from occurring.
And this one is called Gardasil 9, correct? Okay, now there's another type of a drug too.
Well, there's the old Gardasil, and then there's a GlaxoSmithKline product, which is only HPV 16 and 18. Those two are the most important viruses. 16 and 18 cause most of the cancers, but not all of them. That's why we went from 70% effective to 90% effective.
Okay.
And so why not get the best?
But the second drug, from what I understand, Cervarix, is only for women, correct?
I don't know the answer to that.
Okay.
I don't know why that would be the case, and if it is the case, it probably should be corrected. But it's cheaper, It's available more worldwide, I think, and it's just for cancer-related types only. It doesn't protect against condyloma and HPV-related warts.
Right, so we like the 9 one.
I personally
prefer it.
do, but just because why not get the one that's the most protective against all illnesses?
Sure, sure. So you talked about the age groups where you should get it. Is it different between boys and girls?
The FDA approval is different, and again, that's a cost-benefit calculation by the FDA. Boys is 9 to 15, girls is 9 to 26.
Okay.
I assume that will change as more cost-benefit data comes out. The drug companies, when they perform trials for the FDA in order to get their approval, have to spend a huge amount of money, and so I think the boys have not been evaluated at older age groups yet in order to get the approval for the older age groups. There's no really good reason to change the ages for different sexes.
Now, I know I can see some moms and dads out there that are probably going, 9 years old, my kid.
Well, I want to give it to babies. So, I mean, if you look at hepatitis B, it's given at birth, the vaccine. There's no reason not to give the vaccine at birth. The immune system is the best in a baby. And so the reason we give it at currently at 9, 10, 11 is because we don't know how long it lasts. So it's cheaper to give it from 9 to 12, because if it lasts 10 years or 20 years, if it wears out over time, we don't know that yet. And so they don't want to give it to babies and then have it worn out by the time they're 25. So personally, I think the data will come in that we should give it to babies, and then we should boost them when they're 12 instead of waiting. Because the mother has HPV, for example, when she delivered the baby. Well, there is such a disease as laryngeal papillomatosis, which is HPV-11. We could be preventing all those babies from getting laryngeal papillomatosis if we vaccinated all the babies at birth.
Right,
so
and that's another reason, when I was doing a little bit of research, why providers feel like both boys and girls should get it, is because it's not just HPV, it's not just cervical cancer that we're protecting
Well, there's
against.
lots of different illnesses, absolutely.
What kind of other cancers could we be preventing?
There's head and neck cancer, and that's men and women. There's anal cancer, there's vulvar cancer, vaginal cancer, penile cancer. HPV laundry list may get longer, but right now that's our understanding and awareness.
How is the vaccine administered?
It's an injection, and that's unfortunate. It's 3 doses. Okay. And so the studies have all been done with 3 doses, and so the kid has to come back in 1 to 2 months, and then again in 6 months, and that is a burden. Missing school, mom missing work, or dad missing work. Pharmacists can give it. So that might make it easier, because then an after-hours vaccination might be available, may be easier for people. But getting 3 shots is much more difficult than getting 1 shot. So in Oklahoma, 57% of girls have been vaccinated once, 45% of boys have been vaccinated once, but only 30% of girls have been vaccinated 3 times, and only 17% of boys have been vaccinated 3 times. They just can't get that 2nd and 3rd shot.
Right. We think we're too busy, but we don't realize the consequences if we don't.
Right, right. And so we actually have reminder systems. There's text messaging systems. Merck has developed things that you can log on to their website and get reminded so you don't forget. And as I said, pharmacists, CVS, Walgreens, Walmart carries it, so we can make it more convenient, and we're trying. We actually have a coalition of pediatricians, GYN oncologists, health economists. We're trying to get insurers and pharmacists, everybody together, to try to take away those barriers to help moms, help kids to get their vaccinations as easy and convenient as possible. No excuses. The same with screening. You know, cervical cancer screening is available free at the health departments. People aren't aware of that. They don't know they can go and get their Pap test at the health department if they don't have insurance. And hopefully the Affordable Care Act and all will help also to help more people be insured. Hopefully people will be able to get their screening done. Hopefully cervix cancer rates are going to go down.
Maya has a great question here.
Okay.
If I have already been sexually active, is there any need for me to still get the vaccine? Can it still help me?
Yes, absolutely. There are, as I said, there's 9 HPV types in the vaccine. We don't know whether you were infected or not. Everybody should be vaccinated, whether they've been tested, whether they've had an abnormal PAP, whether they've been sexually active. There's no barriers to being vaccinated.
Okay, even what if you're pregnant?
That's a good question. I don't think you should give it in pregnancy, but I don't know the answer. I
Okay.
admit that. I don't do babies anymore. So I have to look.
That's why you consult with another specialist.
Yeah. I don't know the answer to that, but I know there have been a lot of babies born to women who were pregnant and didn't know they were pregnant when they were vaccinated, and there haven't been any consequences of that because it's on the FDA website. But I don't think you purposefully give the vaccine when they're pregnant.
From Marie, my children were vaccinated when the first HPV vaccine came out. Now that there is a new vaccine that protects against more strains that we talked about, should they get another shot, a series of shots, or is the previous vaccine sufficient?
That's a great question. And I honestly don't know the answer to that in terms of whether health insurance will pay for it.
Right.
If you've already been charged for that, if the health insurance has already been charged for the HPV vaccine, they probably don't want to give another one. So I'd probably say that most likely we're not going to do catch-up on kids who have already been vaccinated. And you'll have to pay for it yourself if you choose to get vaccinated again, is my guess, but I don't know the answer.
Is the vaccine pretty safe?
Absolutely. It's the safest vaccine we have. So if any vaccine is safe, this one is.
Any side effects?
Ouch is the big side
Really?
effect.
Yeah.
It hurts to be injected. There's
Right.
headaches, and passing out are the most common side effects that are reported, and that's because those are the most common things that people do when they get a shot. It doesn't matter what the shot is.
We hear it over and over, don't take the chance, get the vaccine. And that's the message today, right?
Absolutely, yes.
All right, Dr. Walker, thank you very much for joining us
Thank
today.
you.
We really appreciate it. And thank you all very much for the questions that you submitted. And we'll see you again next week on OU Medicine Chat.
You gave me some homework to do.
Oh.